a master's in social work, and I'm a clinical social worker with Pride, and I'm also a licensed alcohol and drug counselor. And so I belong to boards that are related to that. Well, actually, it was kind of by accident. Maybe not so much an accident, but it seemed that way. I was a carpenter at the time, and I was younger. And I also worked with a community organization. So I had been trained by a group out of Chicago to do community organization. And at the time, I was an 8th grade dropout. And decided that I wanted to get my GED, got that, and was working in construction, actually earning pretty good money because I was a journeyman carpenter. And the hospital district there in Amarillo, Texas, decided that because I knew the community and knew the culture and everything, they wanted to talk with me. So they recruited me and asked me if I would be willing to work with alcohol and drug kids in the communities. And so I started working out on the streets. I graduated with a bachelor's degree from what was back then West Texas State University. It's now part of A&M. Took me about 5 years to graduate. It was some pretty hard times. And then many years later, when we moved to Nebraska, my wife and I were driving by UNO, and I just said, I'm going to graduate from there someday, and I decided to go. And so the office that I worked for at that time helped me also get through school. That is a really broad question anymore, because what was needed back then, or maybe a few years ago, is not what's needed now. And primarily because of 21st century skills that are coming in to our school districts, and the idea that we're not looking anymore at helping students graduate, but also looking at the goal of how do we get them into universities and how do they compete in the global market. So you're asking a question that is on the verge of actually becoming or transforming into something rather large. We do kind of like this face-to-face, but the digital economy is growing in such a rapid pace that I think it's going to transform the field completely into a whole different animal. I'm not sure that the field is ready for that because of the way that we work, but it's going to do it whether we want to or not. So my advice would be, I'm not a person that necessarily looks at people with 4 O's. I like people that can think, that have common sense. So I would look at students not necessarily learning how to read, write, and arithmetic, but more so into how to deal with the digital media and how to market it in such a way in the helping field more than anything else. The language is also going to change. I know it is. We have a tremendous problem in that a lot of the services, let's say in this area, that are to serve young people in need, kids with mental or emotional issues or behaviors and so forth, are the ones that are not getting attended to. So I think that it all is going to depend on what happens with the government. It's one of those things where you are in the midst of not being able to decide what services will be, simply because even in Nebraska, the state government is making decisions of how to shift and change departments with the Department of Health and Human Services, which affects services for families and children, which affects private practice. The nice thing about where I sit as a private practitioner is I don't necessarily have to deal with red tape. There may be entrepreneurial possibilities, but it's not as easy as opening up an office. There's a lot that goes into it, and what I usually advise people coming into the private practice is you need a very good accountant that you can trust, and you need a good attorney, because it's a business. You're not going to survive just providing services. It'll eat you up. And again, when there's a shift in state government, there's also a shift in what clients can and cannot afford. So it becomes difficult. Well, that's a question that I get asked by people, and I tell them I've been doing this for over 37 years, and they ask, do you ever get burnout? No. And there's two answers to it very simply. One of them is, this is what my vocation is. So for me, it's a vocation. It's not a career, it's not a job or anything. It's strictly a vocation. And there's reasons why I'm here, why I do this work. And there's reasons that got me here. The other is that, for me, there's nothing more rewarding, personally, in being able to see, and this may sound like how cliche-ish, but I don't mean it that way in any possible way. There's a joy and satisfaction in being able to see people change their life and not only live to their full potential, but also live out the dreams that they've had before. From young all the way to old, those things are there. So it's more so having to watch people metaphor into the person they really want to be. I think everybody has those aspirations, and sometimes people are held down by it. So the most challenging would be working with people who are stuck in the mud and can't get out, and there is a way, but they refuse it. And they will continue that way for years. Do you give up on them? No. Sometimes, literally 10 years later, 15 years later, they show up again. But that's the most frustrating, is when you see people have the possibilities, but they can't have insight into them and cause the change that they need. Actually, that's kind of heartbreaking. Probably the responses are very cliches: compassion, love and care for mankind, things like that. But I think one of the most important things is the desire to be a part of somebody else's journey. I think that's extremely important. Everything that I have studied over the years and gurus of the field and so forth have all agreed that medication only helps like 22% of the population that uses medication. But what they have found is the most instrumental in anybody's life in terms of change is the relationship. And so I really believe that you have to be vulnerable enough to sometimes share yourself in terms of your own history, although the field says, oh, no, we don't talk about yourself. I would just say, be able to travel the journey with a person. Most of the clients that I see, quite a few of them, stay in touch even years later, but they always remember the relationship. They remember the sharing. They remember things said. They don't look at, oh, that strategy you used or that medication you sent me to get or this other thing is what actually did it. They don't look at that. They look at, did you travel the journey with me? And did we have talks? And did that help me? Yes, that's what did it. The best teachers that I have in terms of my field are actually the clients. They teach me more than anything else, more than the gurus do, or any classes or any training or anything, because they're willing to share themselves with you and you just learn. And what you learn from one client, you learn for another client, who learn for another client. And a lot of times I take the things that I learn from them and I try it out on other clients, and well, it does work. But to stay certified or licensed in the field, I have to be able to study all the issues of domestic violence. I work with trauma, children of trauma. I work with ritualistic abuse, sexual abuse, incest. I work with all the addictions, including pornography, including anything that can be an addiction, whether it's food or whatever. I'm also a hypnotherapist, so I do study hypnosis and I create my own trances and so forth. So when you look at the things that I work with and specialize in, I have to have hours of training in all those to stay up. I'm also an alcohol and drug counselor, So I have to take hours that fulfill my licensure with the state. And that means licensing for social work, licensing or the American Society of Clinical Hypnosis. That means as a social worker, all those things have to be fulfilled. So I'll go to those trainings as best as I can. The one thing that I would add to all this is the same thing that I always do with students coming in, interns. I've trained a lot of counselors in my history. I love working with new people coming into the field. The one thing that I always advise about that is I think it's always good to take care of any baggage that might be left over. The other is I think that there's a notion that is thought about that this is easy work. And some clients will tell you, oh, yeah, I wish I could be sitting there and doing this. And I go, I'll trade you. It's very hard work. It's extremely rewarding. And the other is, most important is, I ask anybody coming in, I want to know what your care plan is. I want to know when you get stressed, when things are going rough, when your clients don't cooperate, when you're just overloaded and overwhelmed. How do you take care of yourself? And if you don't have a plan for that, you need to come back and give me a plan, because I won't work with you unless you have that plan. You have to take care of yourself.